pandemic health response. They'll be available for questions after my comments. My office have been recently actively engaged with representatives of the Yakima community in government and healthcare and business leaders in Yakima County. And we have been discussing the extremely serious threat that now is faced by the citizens of the Yakima Valley. I want to just describe the current conditions that bring us here today and why this is such an emergency situation. Just a few of the facts that we face, and they're unpleasant. Yakima Valley has probably the highest rate of COVID-19 per capita in the Western United States and on the West Coast. 22% of hospitalizations statewide for COVID are in Yakima County. Yakima County has more cases than the total case count for the entire state of Oregon, which we know is much bigger than Yakima County. One of the most troublesome statistics that face us is that 26% of the COVID tests in Yakima County last week were positive. This is an extraordinarily high rate of positive findings of any test cohort. And I point this out because what we're talking about here today is a problem not just because we are testing more, but because people are sick more and are infected more. This 26% is extraordinarily high. 19% of the hospital beds in Yakima Valley are now occupied by COVID patients, while statewide that is 2.5%. That's 19% in Yakima and 2.5% for the remainder of the state. 10.4% of all COVID deaths in Washington are in Yakima, and whereas Yakima represents only 3% of the state population. At this time, Yakima has had 5,915 cases. King County has had 9,062 cases, and we obviously know King County is many times larger than Yakima. So the most troublesome, perhaps, statistic at all is that the infection rate in Yakima County per capita compared to King County, it is 27 times higher in Yakima County today than in King County. So we know that this is frankly, a desperate situation for public health, for our ability to reopen Yakima, which we want to do, and for the health and safety of citizens in Yakima County, and not just for Yakima County, but for the entire state of Washington. Because as Yakima County goes, so goes the rest of the state, given the fact that our state is interconnected with Yakima County. COVID-19 has overwhelmed the Yakima County health system and the business community. This was reinforced for me when I visited Tuesday with local leaders. Despite our efforts and the earnest efforts of some of the leaders in Yakima I met with, who I know are working around the clock, the hospitalizations for the residents of the valley are mounting. We are frankly at the breaking point, and we have to make decisions looking forward. We can't be a month from now without acting and seeing the explosion of this virus, which is now taking place. We don't want to see people in parking lots unable to get hospital care. And if we do not act aggressively now, that is what's going to happen. This is happening. Well, I hear some voices as saying that this is overblown. The facts are otherwise. And the desperation faced by families who shortly will be having trouble getting health care is clear. ICU patients are being transferred to Seattle for lack of capacity. The number of cases in Yakima County is not some data point. These are potential tragedies. Here's the situation we face, and it's difficult because we have to look forward rather than just the present situation. This is clear. Without additional measures, without us doing something actually quite dramatic, cases in Yakima could double in the next 2 weeks. And the tragedy that is unfolding in Yakima is personal to me. My three sons were born in what was then Yakima Valley Memorial Hospital, and the thought that people could be dying there now as a result of our failure to get on top of this pandemic is heart-wrenching to me. And so I'm committed to working with the Valley to try to stop this from spreading dramatically, and that's why we're here today. This morning I spoke with several elected officials in the Yakima Valley about the next steps I am issuing to help mitigate the spread of COVID-19 there. Right now, the clearest recovery path for the health and well-being of Yakima and Terrace Heights and West Valley and Selah and Grandview requires immediate action. To this end, in the next few days, I will issue a proclamation mandating requiring facial coverings in public spaces in Yakima County. This is a legal requirement. It is not just a suggestion. And that is required if we are going to prevent this disaster from overtaking this beautiful valley. And it is a beautiful valley. I advise local leaders that will give them a few days to get ready while we put the finishing touches on the legally enforceable order that we will be issuing. Now, all of us have some role to play in this, including business leaders. So under this legally requirement, businesses will be legally required not to sell products or services to those who are not in compliance with this requirement. And for them to legally operate, they are going to need to adhere to them. So that essentially means no mask, no service, and no mask, no goods, because we have to all pitch in and pull on this rope. Now, this is the next step, and frankly, it's not necessarily the last step to mitigate measures in the Yakima Valley. We are considering other measures to be helpful, including additional testing, efforts to make sure that our contact tracing and our isolation is adequate, efforts to help families while they're isolating. All of these things we're working with local leaders in the local health district to effectuate. But in the absence of this measure, we are going to be swamped with a tidal wave of COVID-19 if we do not act. Now, this actions or similar actions may be necessary in other counties as well. We've not made final decisions on that. But today we cannot wait. And Yakima cannot wait. As I've indicated, what is happening under the ground there has the potential to affect the entire rest of our state. So I think these are difficult times and they require difficult decisions, and this is one of them. I know, as do the health experts, that there are unique circumstances in Yakima County that explain some of the spread of COVID-19, such as the high percentage of essential workers. But epidemiologists have made clear that community transmission, that means transmission between regular folks at regular barbecues and regular grocery stores and regular parks, is occurring. It's not just in the agricultural industry. And this is now spreading in the state of Washington. A number of our employees who work at the Coyote Ridge facility, one of our correctional institutions, live in Yakima, and we are having increasing infection, unfortunately, spreading. So this impacts all communities, it impacts all ethnicities, it impacts all people of whatever party or faith. And we know that if we pull together on this, we can get on top of this, but otherwise it's going to get on top of us. We believe that the Yakima Valley faces an existential threat, and we think all of us, leaders at all levels, need to get involved here. Now, this is made more difficult because hoaxes about COVID-19 are rampant. And for those who want to downplay this problem in the Yakima Valley, perhaps you need to go up to the hospital and watch people being intubated with this disease. This is a real threat. And we need all leaders of every party to speak up against this and get in touch with the reality that we face. Now, some people blame testing for this problem, but more testing does not explain the more intubations at Memorial or the number of people being transferred to Seattle as they fight for a breath. And that's what they do when they have this disease. Now, I've talked about some of the numbers here, but these cases are not just numbers, they represent people. And the virus that afflicts them poses a cascade of threats, economic and personal. And I take no pleasure talking about this difficulty, but we just can't put our heads in the sand and let this roll over us. I'm also aware of the tremendous economic impact this virus has had on our communities. We want our small businesses to open, and we want to help people get back to work. And talking to the elected leaders in Yakima, they have made this abundantly clear of the difficulties that small business personnel and their employees are suffering because of this. Their frustration is legitimate and real and deep. But we know that the best thing we can do to strengthen our economies so that we can reopen fully is to stop the spread of this virus. That's the way we win this. And we know this is not easy. We know it takes everybody's participation. But I know the Valley. It's where I lived for almost 2 decades. I know it is filled with strong people who are resilient and are willing to work together. And I've seen that in many occasions. So I hope that this mandate expedites us all starting to pull on the rope together in the right direction. With that, I'd like to turn this over to Dr. Tanny Davenport. And Dr. Davenport, could you introduce yourself? And then I look forward to your comments.
Thank you, Governor Inslee. My name is Tanny Davenport. I'm a family physician, and I work for Virginia Mason Memorial. I'm also from the Yakima Valley, so this is not only a place where I work, but it's a place where my family, my extended family, has grown up for generations. If we look at Yakima over the last few days, we've seen just yesterday 208 new cases in the county. That's the second time in June that we've had over 200 cases. In the New York Times today, our total number of cases in Yakima are the 4th highest in the nation. One thing that we see as these rising numbers go up is that it's not just about people testing positive, but we're also seeing increased number of people sick requiring hospitalization. And it's not a disease of just the elderly. Just a few weeks ago, I worked in the hospital on a weekend, and every person I admitted was from the age of 20 to 50, men who were otherwise healthy, but worked in agriculture or local warehouses. This is a virus that, again, people have severe complications from. And just today, we have 42 patients in our hospital with COVID-19, 11 of whom are ventilated. We are at our critical care capacity at Virginia Mason Memorial. In the last 2 days, we've had to transfer 22 people out of our hospital because we did not have enough workforce to take care of them. As we look at the things that could potentially save Yakima and help us and prevent these illnesses, it's clear that wearing face masks is a critical piece to control. At Virginia Mason Memorial, we've had only 1% of our employees get the virus, and we believe that's because we've had a strong program requiring masking from early on, and also are making sure that those people who are sick or have symptoms of COVID-19 are not coming back to work. I know there is a narrative out in the community that masking doesn't work, but clearly, with over 30,000 contacts in our hospital and only 30 people affected by COVID-19, masking works. So I can't ask enough of our community to follow your order. Thank you, Governor Inslee. I think it's critical for us to be able to control this disease, save lives, and to sustain our hospital system. One other fact that I think is important for the state to know is that we project in the next 2 weeks the number of patients requiring hospitalization will double. We simply do not have the capacity and the workforce at Virginia Mason Memorial to take care of those patients. And we're working diligently with the state and other agencies to coordinate transferring these patients across our state.
Dr. Davenport, thank you. And I hope you'll convey our thanks to your colleagues and your nurses and your maintenance staff and everybody else at the hospital. You put yourself, literally, you risk your lives to treat citizens, and we really appreciate this. You are our heroes. And I just think it's, if you're going to risk your life, maybe we could put a mask on. And I don't think that's too much to ask. By the way, I made a misstatement. The number of cases are very close to Oregon. It hasn't gone over Oregon, but very close to Oregon. I do want to comment for folks who are interested in is why we have this emphasis on masks when we did not from day one. And the situation is that the science has become very clear about the efficacy of masks, that they do help in the last several months. And we have watched other states and countries, and it has been compelling that it does make a difference. So as we've learned more about this virus, we have learned that this is an approach that really does work. And that is why we want to use a strategy that has relatively small costs, gives us a chance to restrain this pandemic so we can open up our small businesses and the like. And we are talking to leaders about that subject. So I am hopeful that this succeeds. Yakima Valley is a great place and it deserves success. So with that, I'm happy to stand for questions. And Dr. Davenport, by the way, before I close, Dr. Weisman, did you want to add anything?
I would just add that this wearing face coverings is incredibly important. And as we have Father's Day coming up, and as we have July 4th coming up, we need to not have people having those family barbecues, when outside your household. It is still incredibly important that we keep our physical distance from each other. And, the way we do this is we limit the number of people we have contact with. So while I know it is, some great weather and these are times when we want to be spending time with family and friends, it is simply too dangerous to be doing that. So we need you when you're out in public for essential services to be wearing those face coverings, and we need you to pay attention to all the other hygiene and physical distancing issues we talked about. That is the way we're going to stop this. That is the way we are going to slow the spread of this. And if you have any symptoms, get tested. If you're positive, stay home, stay away from others, because really, as we're seeing